clinical research here at UGI. This is a program that we started about 3 years ago. We have about 12 studies that are currently recruiting right now. Patients that maybe aren't doing well on their current therapy, who need a new treatment or are looking for something different than what they have, treatments that might not be available on the market yet, and we're exploring for different indications.
We run trials for a number of diseases and conditions, including inflammatory bowel disease and celiac disease, liver disease, including fatty liver and cirrhosis.
We are a team of about 5. We have clinical research coordinators, research nurses, but really essential are the partners here at the practice who refer patients to us.
Patients who have a very symptomatic disease. Some of them have abdominal pain and diarrhea and rectal bleeding, and they're quite unwell, and they're scared. When they agree to participate in the research, they become familiar with the team that are highly trained to manage patients in clinical trials, and they're put at ease immediately.
Bella's going to take care of you.
We really take a very close team approach to involving patients in the research. Their care really gets redirected to the clinical research team from their primary gastroenterologist. So it's a really tailored approach. They generally go through a screening process where, even though they're sick, we make sure that they're healthy enough to be part of a clinical trial. Once they get through that screening process, which typically takes 3 weeks or so, we are then able, if everything looks good, to enroll them into the study and give them medication. They'll always be offered free medication that aren't always on the market yet, but that have progressed enough in research to be safe. While they're being monitored by the research division, their care is all free. So all the testing, all the procedures are taken care of by the study. More times than not, there's a stipend involved. It's really a way to say thank you to the patient. We never forget that they're giving extra time than they normally would for just coming in for a visit.
The feedback we get with a great number of our patients is that they felt they were taken through clinical trial in a way that made them feel comfortable and much more secure than if we weren't working with them.
Feel free to call me if anything comes up or anything changes.
We really pride ourselves in being very responsive to the patient's needs. They've always got the numbers of the study coordinator right at their fingertips. If they're not feeling well and they want to come in, they don't have to go through office staff. We have a direct line to the physician. So depending on the urgency of the issue, we generally are back to them within the hour if we need to be.
Doing clinical research with patients receptive to doing it is an important way of getting these drugs to the market. They benefit by participating. We benefit in terms of helping write the science and forge new pathways. Clinical research, it's the backbone behind which medicine can progress. We are very invested in doing that at University Gastroenterology and GI Alliance.
It's really an amazing feeling to see a patient come in 4 weeks, 6 weeks, 8 weeks later, and they're telling us how their symptoms have improved dramatically. They're feeling better, their quality of life is better. And then even better than that, 6 months later, they have a procedure and we see what's going on inside and things are looking better, and we're able to report that information to the patient and say, all of these things are looking better for you. It's very, very rewarding for us and for the patient.
All right, take care.